my name's Hannah. I'm a healthcare professional. I'm sure you can tell I just got home from work. I've been a healthcare professional for a couple years now, and as a healthcare professional, I've seen firsthand on how powerful GLP-1 drugs like Semaglutide and Tirzepatide can be, and today we're going to kind of talk about them. One side effect that keeps coming up literally would be nausea. It's real, it's frustrating, it's something that a lot of patients struggle with when taking GLP-1 drugs, and today we're going to kind of touch on that. So I'm going to talk about how these GLP-1 drugs work. I'm going to be talking about some ways to reduce these GLP-1 side effects. So GLP-1 drugs, so GLP-1 receptor agonist, which is the drug, mimics a hormone in your body to help control your blood sugar and your appetite. So the way that it works is that it slows down gastric emptying, which means you're feeling fuller longer, and it reduces the feeling of hunger, and also it improves your insulin sensitivity. So it helps with control of your blood sugar and things like that. But anyways, it was originally designed for type 2 diabetics to help get type 2 diabetics weight under control. As you can tell, you've seen tons of people that are taking these GLP-1 drugs. Some name brands are like Ozempic, Wegovy, Mounjaro. There's a whole list of ones out there, and it's not just made for type 2 diabetics. A lot of people use these GLP-1 drugs for weight loss. It helps with mental health. It helps with overall health, body health. It's really a great thing. So they are easy to get nowadays. You can go to your healthcare provider. You can go to these weight loss boutiques and get information and get the shots as well. They do come in a shot form. The shots are given weekly. Very, very neat. It can be sent right to your home. So anyways, some of the side effects that occur from these drugs would be nausea, vomiting, diarrhea, compaction. There's a list of side effects that you get when you're taking these GLP-1 drugs. Just like whenever you take any other type of drug, there's a list of side effects that come with it. And these side effects are not placebos. These are real deal. Like this happens. It's not in your head. You do get these symptoms. I've seen it, like I said, firsthand. So these side effects happen because, like I mentioned earlier, these GLP-1 drugs, they create or mimic the hormone that slows your gastric emptying. So food is sitting in your stomach longer, and your body's not used to food sitting in your stomach for longer periods of time, and your brain's like, hey, let's get this food out, let's get this food digested, and your stomach and your hormones are like, no, it's not time to digest it yet. So it's definitely something that your body has to get used to, which is why you get all these side effects: the nausea, the vomiting, the reflux, things like that. And it's very, very common to get these side effects whenever you first start your shots, because think about it, your body's not used to it. This new thing's happening to it, so of course you're going to get some side effects, some weird feelings, some queasiness, things like that. So when you first start the shot is when the symptoms are the worst, or whenever you go up in dosage. So the way that this drug works is, once you go up in a dose, you cannot go back to a previous dose because your body has built a tolerance. So as you go up, you have to continue to go up to, continue the treatment of this medication. So as far as like the nausea and the vomiting goes, there's some over-the-counter medicines that people take A lot of people take like an antacid, a Tums, stuff like that. Other ways to reduce the side effects of the GLP-1 drugs. Not taking something would be eating a smaller meal or eating your meals a little bit slower. Avoid anything that's super greasy or like heavy on your stomach. This isn't good, like I said, because if you eat something that's super greasy and it's sitting on your stomach, your gastric emptying is slower, so it's gonna just sit there and it's not gonna be good. Eat upright. Don't be laying on the couch, laying back, eating some chips or a bowl of ice cream, which I guess you shouldn't be eating that stuff if you're trying to lose weight, but you know what I mean. Drinking lots of fluid, especially in between like eating. The fluid helps you fill up so you're eating less, and fluid, it takes less time to get out of your body. So that's something to consider, some kind of tips and tricks on how to decrease these symptoms with the GLP-1 drugs. But there's one drug that I found that works really well for me. And I haven't taken any GLP-1 medications, but I recommend it to patients that I talk to. It would be Reflux Gourmet. It is all natural. It's made from seaweed, kelp. It's really neat. It's all natural ingredients. It's like it's seaweed, it's sodium, and I think bicarbonate. And what it does, it creates this kind of like barrier in your stomach that doesn't allow your stomach acid to penetrate through, and it doesn't give you that nauseated, queasy feeling. And it works really well for patients that take GLP-1 medications. And another benefit is that it's all natural. It's made from all natural stuff. So instead of going and buying these over-the-counter drugs that are made with some questionable things, this is something that's all natural. It's gluten-free, it's vegan, it's a really, really great option, and patients love it. And I mentioned earlier that I've used this before because it's not just made for patients taking GLP-1 medications. I mean, it helps with any stomach problems, really. It can actually, the Reflux Gourmet can curb hunger. So if you're trying to fast and lose weight that way, it can help with your hunger cravings, and it's all natural, like I said earlier. It's great. I live in Louisiana. I don't know if you can tell, I'm sure I have a little bit of an accent, but I live in Louisiana, and we eat a ton of like spicy, Cajun style food, and it's not always good on the stomach. So I've used it before, and I give it a 10 out of 10. I think it's a great product. I like that it's all natural. I like the way that it works. It also lasts 4 times longer than an antacid. So you're going in there, your pantry or your medicine cabinet, and you're getting an antacid out or a Tums or something, and it doesn't last very long, or it doesn't give you that feeling of relief that you need. And Reflux Gourmet, it gives you that feeling, and it lasts a long time. It's generally taken after you've eaten a meal, or maybe you've eaten a meal and you feel really queasy and not well later. That's also when you would take it. And like I said before, you can use it for when you're fasting, and it helps with your hunger cravings, which is awesome. Reflux Gourmet is also clinically backed. Like I said, I just think it's a great product, and if you have stomach problems or taking GLP-1 medications, it's something to check out. So to kind of end it, GLP-1 medications have been a really great advancement, especially with, how processed and unhealthy our foods are nowadays. Nowadays with weight loss, it's a great success. And they don't have to make you feel sick. There's options out there, some of the tips that I've talked about today, and medications out there like Reflux Gourmet that work really well with these GLP-1 drugs and really, really help people dealing with the side effects. So I've used it myself. I can say that the Reflux Gourmet works, and it's a great way to help with the side effects of these GLP-1 drugs. Like I kind of said before, these GLP-1 drugs are a great advancement in medicine, and I wish the best of luck to everybody who's taking these, who are dealing with these side effects, and I hope that this video helps them find new information and find a way to help with their side effects. And good luck to everybody out there trying to lose weight.